One who follows the spirit of Swadeshi is the one who is ready to serve the very next door neighbor. India is unequivocally heading towards indigenous services and is determined to be self-reliant in all the uphill struggles. On India's 74th Independence Day, PM Modi broaching Atmanirbhar Bharat as a mantra for 130 crore Indians demonstrates a lot about India's fresh vision. Engraving self-reliant India in every aspect. Union Minister Dr Harsh Vardhan has approved National Policy for Rare Diseases 2021. This policy aims at lowering the high cost of treatment for rare diseases with increased emphasis on indigenous research. Before forging ahead, let's take into account the cognizance of rare diseases as per the global standards. WHO describes a rare disease as a debilitating lifelong disease or disorder with a prevalence of 1 or less per thousand population. Different countries have their own definitions that suit their specific requirements. In the US, a rare disease is defined as a disease or condition that affects fewer than 2 lakh patients in the country, whereas the European Union defines rare disease as a life-threatening or chronically debilitating condition affecting no more than 5 people in a population of 10,000. The field of rare diseases is not as easy as its definitions because the outlook of rare diseases keeps on changing as new rare diseases and conditions are identified and reported regularly in the medical literature. According to official data, there are between 7,000 to 8,000 rare diseases, but less than 5% have therapies available to treat them. About 95% of rare diseases have no sanctioned treatment, or less than 1 in 10 patients receive specific treatment. For a long time, doctors, researchers and policymakers were heedless of rare diseases, and there was no real research or public health policy concerning issues related to rare diseases. But not anymore. National Policy for Rare Diseases seeks to lower the incidence and prevalence of rare diseases. It has devised an integrated and comprehensive preventive strategy that encloses awareness generation, premarital, postmarital, conception and post-conception screening, and counseling programs to prevent births of children with the rare diseases. Keeping cost effectiveness in view, this policy has enabled access to affordable healthcare for patients of rare diseases. Not only this, supporting the cause, the central government has encouraged the states in their endeavour towards effective screening and prevention of rare diseases through Centers of Excellence and Nidan Kendras. Besides treating rare diseases, the Center of Excellence will educate, train, ensure high-risk screening in newborns and children, molecular and metabolic diagnostics, and will support research in the area of low-cost therapeutics. Central government is endlessly assisting the patients of rare diseases by initiating essentials. Under the umbrella scheme of Rashtriya Arogya Nidhi, the central government is providing financial support up to ₹20 lakh for those rare diseases that require one-time treatment. Beneficiaries for this financial assistance are not limited to BPL families, but extended to about 40% of the population who are eligible. Further, the central government will take measures for creating a conducive environment for indigenous manufacturing of drugs for rare diseases in the country. The National Policy on Rare Diseases has provided a new dimension to India's healthcare sector and has enhanced indigenous research and development, thus building the strong foundation of progressing India. We will come back with more information. Thanks for watching.